Hi everyone, my name is Dr. Kaushik Sarkar. I'm the director of the Institute for Health Modeling and Climate Solutions, IMAX. IMAX is a global center of excellence at the intersection of health and climate, where we are doing a lot of technical and technological work, especially focused around early warning systems under the Forecasting Healthy Futures initiative of Malaria No More. Several years back, I was traveling to an Indian state called Meghalaya. And you might have heard of Cherrapunji and Mawsynram. These are the wettest places in the planet. And in one of the villages, I remember there was a sizable pond acting as a natural barrier, splitting the street and the homes. The only lifeline between the homes and the street was kind of a makeshift bridge made up of two bamboo sticks. So imagine what happens to the people when these people are there during a torrential downpour and trying to seek services specifically for malaria or these types of illnesses, which also increase a lot during the monsoon season. Similarly, I also observed some locals where homes were perched up a good 30-50 steps above the ground. And so you need to have a precarious ascent on slippery rocks to simply reach the front door. Now during heavy rainfall, these places just fade from our sight and they become the surveillance blind spots, leaving their inhabitants stranded without any vital treatment. Malaria has always been a poorer cousin in the entire health agenda. It doesn't get all the necessary attention that it needs. So I think to effectively communicate the intersection of malaria and climate change, we must use both statistics and the personal stories. So the first part is concrete numbers, and numbers not about 2070s. Concrete numbers that people can underscore the magnitude of the issue now. And then we also need individual stories, because I believe that every climate impact has a human face. Plus, it is important to highlight the ripple effect. So the spread of malaria not only affects individual health, but also has a broader socioeconomic impact in terms of how we can talk about returns, other impacts, other demographic parameters and sort of stuff, to make the overall narrative more compelling and more understandable and emotive in terms of so that people can start acting on them. You not only just strengthen the malaria surveillance, but you also need tools that can forecast cases or that can stratify areas based on the risk, so that you can prepare even before the cases are happening. In addition, I also think even if you are well aware of the potential threats, it is incredibly difficult to plan for all the potential scenarios just because the real world is so complex. At our institute, at IMAX, what we are doing is we developed a constellation of digital tools together, which we call the Malaria Prediction and Planning Toolkit, MPPT. And it includes a dashboard that not just only predict fever and malaria using cutting-edge algorithms, but also we prescribe a lot of interventions and actions based on the real-world scenarios and the predictions. Because it is very important that when you are predicting the risk, you also tell the people that what is the solution, how they need to solve the problem. In addition, we also have mobile health tools which include chatbot, surveillance and treatment recommendation tools, and last mile health education prescriptions. So we are now making this entire toolkit applicable for broader spectrum of climate sensitive infectious diseases. But all of these are actually built on the malaria and the climate nexus. The entire data-driven work should be through one platform rather than having 10 different applications, which would only create a burden for the public infrastructure, rather than having a simple open source, feasible, effective, and affordable open source system. We did that in India earlier in the state of Odisha, and now we are translating it in Indonesia. And probably in the next year, at some point of time, we'll get into multi-country initiatives in Africa where we put this tool, but not only just this tool, but an entire strategic framework to help the countries work at the nexus of health and climate.